We are seeing Swiss Pharmaceuticals react to the partially, I feel like it's the tariff sentiment that's hitting Swiss stocks altogether, but also the drug pricing story from Friday as well. Just walk us through how these drug makers have responded, how much room to maneuver they actually have.
So firstly, there's a lot of uncertainty still for Swiss pharma companies. So the 39% is not actually going to hit them immediately. They sort of have a short stay of execution in some ways. But at the same time, they know that they need to move manufacturing to the US to sort of appease Trump, as that's been very sort of central for him. And also Swiss pharma stocks are, well, the Swiss pharmaceuticals are one of the key reasons for this massive trade deficit between Switzerland and the EU. So they know that they're going to have to come to the table with something good there. And obviously the most favoured nation drug pricing threat is also hitting the Swiss pharmaceutical companies today.
Talk to us about the most favored nation drug pricing, because I think obviously this is something Trump tried to do in his first term, but he struggled with it. What changes now? How can he get it through now?
So last time it was stopped by the courts on a technicality around not sort of discussing it sufficiently with all the players. So potentially he knows he needs to do that now. He knows he needs to go to drug makers and talk to them before it's implemented. It still could be prevented by the courts. And drug makers are very keen to negotiate. So they've already come up with proposals around direct-to-patient drug pricing. And that's something that they're very keen to do because that sort of cuts out the middleman, which drug makers would love to do and Trump would love to do. So there might be some wins for pharmaceutical companies there.
I mean, do they even have the headroom to cut the price of drugs?
It depends on what actually is the ultimate, what ultimately is cut. So if it's just Medicaid, for example, which is, sort of one insurance program for Americans, that might be manageable. If it's across the board, it won't be. But Trump is saying we want Europeans to pay more and we want Americans to pay less. So ultimately he's saying, I don't want your profits to be slashed. I want you to get more money from the Europeans. So we have to see how that all plays out.
But what about kind of moving some of their exposure to other parts of the world? This was something that was floated with the likes of AstraZeneca, for example, which I don't think have commented on this particular dynamic. But at the time when they were facing pressure from some of the supply chain issues extending into China, there was a question of, do you just recalibrate where your consumer base is? Can drug makers do that in Europe?
Potentially, but it will ultimately mean that patients are hit, that patients don't get the drugs that they need. And pharmaceutical companies are they want to bring their drugs to the most patients possible. So, there'll be a lot of pressure also from governments in Europe to ensure that that doesn't happen. But there is that threat, and pharmaceutical companies have been open that, if they're forced to raise prices in Europe, in an unsustainable way, they just won't launch that drug in Europe. So that means that then, patients in Europe just won't get these new innovative medicines that they need.